Hi everyone, welcome back to your channel. I love Pharmacology, and in this session, let us learn about the inotropic drugs. So, let us understand what is positive inotropic agents, their mechanism of action, what is the result of the inotropic effects, what happens in case of heart failure with reserved ejection fraction, and what are all the exceptions. And also let us see which are all the drugs which are useful as inotropic agents. So coming to the positive inotropic agents, so that means basically they are going to increase the cardiac contractility. Please remember, these drugs will going to increase the cardiac contractility. So by increasing the cardiac contractility, it will going to increase the cardiac output in case of the failing heart. So basically it causes the cardiac muscle contraction, contraction, contraction. So what is the mechanism of action? So basically all this inotropic drugs or a group of drugs will going to increase the cytoplasmic cytoplasmic calcium concentration, which in turn increase in calcium concentration will going to increase the cardiac contractility. So this is the basic mechanism behind the inotropic drugs. So what is the basic mechanism? All of these agents will going to increase the cytoplasmic calcium concentration, thereby, as you know that the calcium action on the muscle is to increase the contraction. So by increasing the cytoplasmic calcium concentration, the muscles will going to contract. Is it clear? Okay, fine. So basically the end result will be increase in the cardiac contraction, thus leading to improved cardiac output, where in case of failing heart. So what is the effect of inotropic drugs on the heart failure with a reserved ejection fraction? So the studies have shown that all these positive inotropic drugs in a heart failure with reserved ejection fraction will also increase the intracellular cytoplasmic calcium concentration, and they have been associated with decrease in the survival rate. So what is the exception? So all the drugs are, because of this reason, all the drugs are used for short period of time, short period utility, but exception is, but except digoxin, except the digoxin, all other inotropic drugs are used for only a short period of time in an inpatients. So what are all the inotropic drug you should remember? So inotropic drugs you should remember, first one is the cardiac glycosides. Cardiac glycosides. So under this you have got digoxin. Second one is the beta adrenergic agonists. So under this again you have two drugs which are starting with the D. One is the dopamine. Second one is the dobutamine. Third is the phosphodiesterase inhibitor. Under this you have got milrinone. So you have got the milrinone. So these are the three groups of drugs which are used as a inotropic agents. So please remember this. This is very useful in terms of writing a short answer for 3 marks as well as answering the MCQs. So please remember, inotropic agents, you have cardiac glycosides, phosphodiesterase inhibitor, and the beta agonist. One is the digoxin, dopamine, and the milrinone. All this drug common mechanism is they're going to increase the intracellular cytoplasmic calcium level, thereby leading to increase in the cardiac contractility. And use of this drug will be for only shorter period of time, except for the digoxin, and the survival rate in case of the heart failure reserved with ejection fraction is very less. So if you find this video useful, please do subscribe to my channel. I love pharmacology, and do not forget to share and hit the like button for more updates on pharmacology. Thank you.